So we have peptide therapies available, and some of them are oral, some of them are injectable, and they can help address a whole host of different symptoms. And we use it as adjunctive therapies as well after we do a full evaluation. Peptides just means amino acids in a chain. So it's the building blocks for proteins. And it helps signal the body. And depending on which peptide we try to use, it helps signal that specific pathway that we would like to try to improve. Some of the ones that we like to use are oxytocin sublingual, has been a good adjunct for women for libido. They have told me that it has improved the levels of desire, that they feel better about themselves. And we've had patients who have been using sermorelin and GHRP6. These are peptides that are very good to use for people with arthritis or joint symptoms. Inflammation improves and they get better. There are other peptides that we use to help stimulate growth hormone, and growth hormone is a hormone that helps with repairing tissue. So it's helpful for people with arthritis, it's helpful for people with joint symptoms.
We have a new way of increasing secretion of human growth hormone in the body by use of what's called secretagogues, which tell the pituitary to secrete more human growth hormone. A lot of athletes use secretagogues to optimize their health. I was a professional ballerina and I love being a ballerina, but I could never run. It was actually too painful for me until this year. 49 years, I just started using a secretagogue and I can run. And I typically run between 2 and 3 miles a day. I don't think I would be able to do it without the secretagogue. It just makes running less painful.
There are other peptides that are used that help stimulate collagen formation, and that can be topical, or it may also help with hair growth, and that is also a topical product. So there's a lot of different uses that peptides have come to be in the market. When I use peptides for weight loss, like semaglutide or liraglutide, we have noticed the weight loss is not just subcutaneous fat, but the visceral fat numbers go down. It's important because it is this visceral fat that is associated with medical conditions like diabetes, like high cholesterol, like hypertension. And so it's not just for vanity, it is for health.
I do get new patients and sometimes older patients that come in going, tell me about peptides, what do I need to know? Lots of different peptides for lots of different things. There's peptides for brain function, there's peptides for gut function, there's peptides for anti-aging purposes, for lengthening telomeres, there's all different kinds of peptides. And it is important that, number one, you know your source of where they're coming from. The peptides that we prescribe, that we get and obtain for patients here in this practice comes from a compounding pharmacy. So we know that they're clean and we know that it's a very pure form. There's not a lot of excipients or maybe toxins or things that aren't necessarily needed in it, so that when you use them, your body's going to get the biggest benefit from them.